Hi, I'm Dr. Nicole Keaty from Medical Associates. I'm a psychologist here, and we wanted to offer you some tips for coping with COVID-19. This will be a period where a lot of people are engaging in the practice of social distancing, and we know it can be a trying time, and we wanted to offer some tips to help you cope. So one tip is to establish a new routine. You will be going through a period of transition in which you'll have to change your routine. It won't involve many of the activities you typically enjoy. And it is helpful if you can establish a meaningful routine that includes some of the things you enjoy, some time for connection, and in an altered way. So each day it helps if you get up and get dressed. Try to have a goal that you accomplish in the morning before noon and a goal that you accomplish in the afternoon or evening each day, something that is achievable and that you can accomplish and feel that sense that you have established a routine that's meaningful for you. Another thing that can really help during this period of isolation is to step outside on a daily basis, even if for 5 minutes. If you can engage your senses, listen to the sounds, notice the smells outside, notice the feeling of the fresh air. Really try to enjoy some time of feeling free of the bounds of your home during a time where you may be spending a lot of time there. It is also quite helpful for physical and mental health if you can exercise on a daily basis. Try to get some movement of your body, even 5 repetitions of an exercise that you know that you can do easily. Just trying to anchor that to an activity you do every day. Perhaps while your coffee's brewing, you do 5 push-ups or 5 lunges. Just try to stay physical and active and move your body. Another thing that can be very important right now is trying to stay connected the way you can. It will be hard to stay social during a period when you're socially isolating, but using online platforms to stay connected with people can be very beneficial. It also is helpful if you can mail people, send them a letter, or try to call someone on the phone, which we don't do a whole lot, or use FaceTime to try to connect with people so that you don't feel entirely isolated. It's also helpful to recognize that your thoughts may start to go in a lot of directions. We'll have lots of worry thoughts. This is what our minds do to try to protect us, but it's helpful if you can recognize that these worries are just worries. They're not necessarily entirely rational. They're what ifs, they're worst case scenarios. Notice those thoughts, let them pass. Allow yourself to shift your focus to things that are more productive at the time, more positive at the time. Try to reframe with positive outcomes of what you're going through. Just recognize that although worry thoughts will come and go, we still have other things to be grateful for. And it is helpful to practice gratitude by every day listing 5 things you're grateful for, 5 things that you have found beneficial in your day, maybe expressing that out loud to your loved ones or even writing them down. Just noticing what you have to be grateful for during a very difficult period of time. Please stay in touch with our office if you have any questions about anything I've said or any questions for the Psychiatry and Psychology Department. Our number is 563-584-3500, and we remain available for questions.